Revision ligament surgery is whereupon the patient, the individual, has already undergone surgery, and for a number of different reasons, the operation needs to be repeated. It may be the operation has gone very well. It may be there's been a problem at the time of surgery. And often the knee can be re-injured, which is something as knee surgeons we recognise regularly. And therefore, the reasons for undergoing revision surgery are broad, but often include the person's got back to sport and unfortunately has re-injured their knee and therefore needs to have the operation repeated, usually in a different way, but they need to have the principal ligament reconstructed once more. Ligament reconstruction has failed for a number of different reasons. Firstly, you can get an infection when you have an operation. Any operation has a risk of infection. Your surgeon should discuss that very clearly with you. So if you get an infection, which in ligament surgery is really quite rare, that could be a cause of failure. Another cause of failure if your knee is stiff. And what we mean by that as doctors, the knee doesn't move normally. So that can be due to arthritis of the knee that hasn't really been appreciated at the time of surgery. It can be arthritis which has come on since the operation, so stiffness or loss of movement. You may find the operation is painful. Your knee becomes painful after surgery. There's normally a reason for that. It's not usually something that happens after surgery with successful ligament reconstruction, but it can happen. That knee obviously needs to be looked at. But the most common cause for ligament reconstruction needing to be redone or revised is the ligament's been re-injured again. And if it's re-injured, and the same reason for having the operation the first time still applies, so it's a younger individual who's active and wishes to remain active, then one needs to go back and redo the operation and go through the advantage and disadvantage with the patient on a very careful, individualized basis to work out what's the right option for them. There's no real limit to how many times a ligament can be re-operated on. I have personally operated a ligament for the 4th time. That's very unusual, but I have a particular subspecialist interest in complicated ligament surgery. But basically, if the ligament's been injured twice, then the surgeon really needs to work out as to why that ligament keeps failing. And as knee surgeons, if you have a very specialized practice I do, there are lots of things that one can look for, and often the details are very subtle. Sometimes the details are picked up in the physical examination of the knee. Sometimes these details are picked up in a CT scan or an MRI scan, or sometimes simple X-rays, simple radiographs. But there's no absolute limit. But certainly what we shouldn't be doing as knee surgeons is just redoing a ligament operation that's failed without a clear understanding about why that operation has failed and what can we do when we redo it to significantly minimize the chance of the re-injury happening again. There's 2 things to think about. The first is returning to full sport, whatever that sport might be to the individual. And the second thing to talk about when people refer to activities, getting back to work and family life. So if we talk about first-time ligament reconstruction, normally getting back to full activity, jumping, twisting sport, should not be earlier than 7 months after surgery. There's some variability in that, depending on the surgeon, the technique they've used, the patients and the physical therapy, but that would be a realistic timeline. So no earlier than 7 months. With revision reconstruction, then realistically, it's at least 2 months longer than that, and sometimes more. And the timeline for return to sport really depends on the complexity of the surgery and how quickly the patient gets strength back and muscle control back. The second aspect is how people get back to their normal day-to-day activities, family life and work life. And that depends on what the person does. So if you're a manual labourer, a builder, for instance, then realistically, you would be 2 months as a minimum before you'd be able to get back to doing a heavy job. And if you're going up and down ladders, it would probably be a month or so beyond that. If it's office-based work, you obviously get back to work much earlier than that, but you'll need to incorporate understanding about changing your travel arrangements. So for instance, I work in London. So if you use the tube, for instance, or public transport, and it's very crowded, you need to make understanding as an adaptation in regards to that when you get to and from work. So there's lots of things to factor in, depending on individual personal circumstances. The advice to give patients undergoing revision surgery is really dependent on what the surgeon is used to doing. What I mean by that is I would find someone who just does knee surgery personally. So in the UK, we tend to operate on body parts. I am a knee surgeon. I do nothing but operate on the knee. If you're an American patient and seeing an American surgeon, you may well be seeing a sports medicine surgeon who may well have a huge experience in knee surgery, shoulder surgery and foot and ankle surgery, and they do sports medicine practice within those areas. But in the UK practice, you want to see someone that just does knee surgery. You also want an understanding about what they mainly do within knee surgery. So are they someone that has a specialist interest in ligament surgery? And then you can find out and talk to them what graft choices they offer, because often, if a surgeon only offers one particular graft choice to their patients, they're someone that's not doing complicated ligament surgery on a regular basis. Because there are different grafts that our patients can have at the time of surgery, which have different advantages and disadvantages. And what I try and do, most people who do a job in a similar way as I do, they will discuss the patient, assess the patient, and work out what is probably the best graft choice for that individual, particularly revision surgery, and talk about the pros and cons of different grafts. So lots of things that you can ask the patient, get an understanding, but do your research beforehand. Find out, what does this person do? Are they a dedicated knee surgeon? They do lots of different body parts, which in the US may be a different conversation to the UK or Europe. And is it within knee surgery, do they really focus on doing ligament reconstruction? They really focus on sports medicine knee surgery. So these are the ways you get a better understanding as regards your surgeon and what he or she may be doing, particularly as regards revision reconstruction surgery. And for revision ligament surgery, you really do want to see someone that is dedicated to soft tissue ligament reconstruction surgery. Personally, I think it's sensible that you go to see someone for your revision reconstruction who just does a large number of ligament operations day in, day out, is very familiar with advanced techniques and keeping your knee in the best possible condition.